What if the secret to adding healthy years to your pet's life isn't just medicine, but mobility, dentistry, and proactive rehab? Today, we're talking about the type of care most pet parents wait too long to start. Welcome to Unleash Curiosity by Vital Pet Life.
I'm Dr. Amber De Silva, veterinarian and advocate for integrative pet care.
And I'm Donnie Yamamoto, founder and CEO of Vital Pet Life. We're so glad you're here.
This is a space where curiosity, compassion, and science converge, where we explore the powerful mind-body connection that supports your pet's health and your own.
Each week, we'll dive deep into the world of pet wellness, breaking down myths, exploring ingredients, and learning from expert voices across the industry.
From nutrition and sustainability to transparency and advocacy, we're here to help you feel more confident, connected, and informed in your care choices.
Let's get into it, because when we know better, we do better. This is Unleash Curiosity. Welcome back to Unleash Curiosity. I'm Donnie Yamamoto, and today's episode is about something every pet parent wants: more healthy, active years with the pets they love.
And I'm Dr. Amber De Silva. Welcome back to our podcast. Our guest today knew he wanted to be a veterinarian as early as junior high school. He studied at Utah State University and Washington State University. In 2006, he founded Antelope Animal Hospital, where he's built a practice centered on treating pets and the humans attached to them like family.
He's also a certified canine rehabilitation practitioner through the University of Tennessee, bringing advanced rehab techniques to help pets recover stronger and live longer. In 2024, he expanded his surgical skill set to include orthopedic procedures, spine surgery, rehabilitation, advanced dentistry, and complex medical care, all under one roof. Wow.
In addition to running a successful practice, he prioritizes keeping the hospital clean and looking professional. He prides himself on his team and their ability to make their clients feel like family. We're so excited to dive into pet longevity, rehab, dentistry, and proactive care with Dr. Paul Tonioli. Dr. T, welcome to the show.
Thank you. It's good to be here.
Yeah, we're so excited. Like, I love reading the whole resume. I feel like that's Dr. T is my dream vet. I wish you're close by.
So, Dr. T, you knew you wanted to be a veterinarian in junior high. And what sparked this clarity so early? And is it true that your school counselor helped you to spell it?
Oh my
Yes. Yeah. So this is a interesting background. So when I was about 6 years old, we were in a plane crash and my
Oh.
mother passed away. Now, why is that important? Because my mother was a nurse. And so growing up, I always wanted to be very close to my mother. Little side note, just for some fun, I learned to sew because my mother was a seamstress. And so
Oh.
I have made my wife what I call tubes with sleeves. We were in vet school, dirt poor. So, again, just trying to be close to my mom. Now, why is that important? Well, I thought I wanted to be a medical doctor or human doctor. So probably around, or some kind of doctor, I should say. Yes, I did want to be a doctor in junior high, veterinarian. And my veterinary, but I think that at that point in my life, it's like every kid wants to be a veterinarian, like every kid wants to be a jet pilot, right?
Yeah,
So
yeah.
yes, my 8th grade counselor said, "Well, do you know how to spell veterinarian?" I was like, "I have no idea." So we literally sat down in his office and learned how to spell veterinarian. So that is very true and very fun for me to remember. But when I was in 16 or so, my first job, I was what they call an x-ray runner in the human hospital. Back in the day before digital x-rays, they were all film.
Yeah.
And so an x-ray runner would run the x-rays from wherever they took them to the dark room. You would go in, you would process the film and get them back to wherever they needed to be. They had a little portable x-ray machine. You would take that through the hospital and like to the ER. Well, while I was there, I saw a baby come in who was from childhood. I saw a
Wow.
lady who committed.
my
I was asked to help pull life support of a old elderly lady. She was probably in her 90s. I was just like, humans are mean to each other. Maybe I do want to be a veterinarian. And so it just stuck. And so I also
Wow.
think that another little tidbit, I went to Washington State University, and at Washington State, they have a white coat ceremony, which was the first, now we may have to check our facts here, but I'm pretty sure I am the first white coat ceremony for veterinarians
Wow.
was at Washington State when I
Wow.
got in. Now, what was also cool about that is the first female veterinarian to become president of the AVMA came and spoke at our inauguration and kind of introduced this white coat ceremony. Those are what I remember. Facts, they can be checked if you want to. But she said something very, very specific that has stuck with me. And that is how many people wanted to be a veterinarian because you just from like the beginning of time. And my hand went up. I truly believe, for at least me personally, this is a calling
Yeah.
to be a veterinarian. It is my calling to do it, if that makes sense. I don't know how to describe it if you don't quite understand that, but internally, I know that I was born and raised to be a veterinarian. There you go. So
That's
that's why or how, and I became a veterinarian. And yes, again, junior high, counselor's office, VETER. I still have to think about it, so I'm not even going to try, but we can laugh about that.
well, that's really cool though. I mean, I get about a calling. Some people, like me, I feel I had a calling with animals, but I didn't really, maybe it took a while to understand. I like entrepreneurial, but I didn't know that, it goes back to my love of animal that basically made it easier to do this business or this job that I'm doing right now. Because
Sure.
I get to, learn more about animal health and how I can help them. But yeah,
Yeah.
that's so cool. Okay. What is a canine rehabilitation and why do most pet owners wait too long to consider it? Most people assume rehab is only for post surgery cases.
Yeah, that's a great question. To define canine rehabilitation, basically, we need to think physical therapy.
Mm-hmm.
Now, another fun little factoid is physical therapy in the human world is actually a trademark wording. So veterinarians can't be physical therapists because
Oh,
it's again, I think it's kind of maybe a silly rule, but you have to actually be a human physical therapist to say you're a physical therapist. So
oh.
veterinarians around that call it canine rehabilitation. So it's mostly
Hmm.
physical therapy.
Yeah, well, we
And
didn't
so if
even
you
know.
think, yeah, it's just a weird factoid
Yeah,
thing,
I didn't know that either.
So now things could have changed in the last 10 years, but when I first started, that's why they call it canine rehabilitation practitioner instead of a canine physical therapist.
Mm-hmm.
I don't know that human therapists would want to come and sue us for saying, but if somebody had a beef with it, they could. So if you just think about physical therapy, just think about we're doing passive range of motion, we're doing exercises to strengthen core muscles, we're
Mm-hmm.
doing laser therapy, massage therapy, ENS units, which are those electrical stimulations of muscles. One of the cool things about veterinary, I know they have them in the human world, but not everybody goes into a physical therapy office and sees an underwater treadmill, right?
Yeah.
And that's one of the great things about veterinary medicine, or at least what I think is really cool, is we have an actual full size
Yeah.
treadmill that you could walk or run on that is in a water tank, and you raise the water so that the dogs are buoyant because that takes the joint or takes off
The
the pressure
press.
off the
Yeah.
joints as they're trying to get walking, right? So, and most parents, kind of a little bit of a sad thing about veterinary medicine is it's kind of an indiscretionary spending, like it's your
Mm-hmm.
spare money. And
Mm-hmm.
I don't know if insurances cover it yet. I think some do actually, because we have a client right now who uses his insurance. But it's expensive. Rehab's
Yeah.
not cheap. And so I think that's why some people wait. Another problem or reason people wait is it's not popular. And so it's just not around. People don't know about it. We actually just picked up a new client who actually kind of chastised me. Why don't you advertise? Where's this at?
Yeah.
You should be on all these websites and all this. And she was really grateful because I'm closer to her house than having to drive to Salt Lake, which is a big city from where we're at. It's about a 30-40 minute drive. So she was just so grateful to find us. But those are some of the reasons I think people wait too long to consider it.
Mhm.
Mm, And really, I think most of the time it is post rehab because most of the time the dogs that need rehab are those that had some orthopedic procedure, whether
Mhm.
it be a
Yeah.
back issue, a hip issue, a knee issue. But there's others. We've helped dogs with soft tissue injuries, helped some dogs with obesity. I even
Yeah.
did one dog. I actually conditioned a dog to get him ready for a dog show to go out and have the stamina to be able to
Oh,
run up and down the field. And he just
wow.
bulked up in muscle. So he looked really good.
So I have a question. So as you've said, like I'm jealous. I'm really jealous that I don't have you in my area. Like I bet there's a lot here in LA, but I still have to find one.
Yeah.
But anyway, I feel like as pet parents, we should know, right? That this rehab could be like added to sort of like a routine or something that you can add on if you can afford it. 'Cause our dogs like run around a lot. Like, in what age you think that you should consider doing that instead of like waiting for them to be limping or to have like orthopedic like issues?
That's a great question too. And I don't know if there's a particular age. We do have a few. Some of our clients right now are geriatrics, 12, 13, 14-year-old dogs, who the owners just really want to continue to help them have the
Mm-hmm.
quality of life that they can have, to go for hikes, go for walks. They see
Mm-hmm.
that they're slowing down. And so they're coming in for strengthening, not
Mm-hmm.
necessarily rehab, but more strengthening. So we do exercises, we do um, the underwater treadmill, and then they have to go home and do some of the exercises at home.
Mm-hmm.
Let's see. We have young dogs, agility. We have some agility case dogs. We have those that are, you see on the clips of dogs running through the tunnel and over and up the arch, and um, they come down hard. They're jumping over those.
Even with
Um,
pavements, right? I get nervous
yeah,
when my
yeah.
cat's running.
I mean,
Yeah.
you think about jumping all the time and landing hard on your
Yeah.
wrists and your knees, and it all takes its toll, just like any athlete, and I think that's maybe another thing. A lot of physical therapy is more, well, I can't say it's more, but we have a lot of athletic dogs more than
Mm.
just your common household pet.
Like the show dogs or dogs that go to
Yes.
agility classes.
Agility, hunting. A lot of hunters that have injured their dogs want to come and get them back into shape for hunting season. Yeah.
Okay, that's cool. But I think this is good because like I feel the common people like us that doesn't do all those like activities with our animals. It should be something that we should think of. Like now I always tell my 3-year-old puppy not to run around too much or not to let him jump around because like I mean it's good to run around for a little bit, but again, take care of your back. That's what
Yeah.
I do. Yeah.
Yes, and that's actually one reason I became part of the reason I did physical therapy is as a couch athlete, if you call it that. I mean, I've done triathlons, I've done marathons, I do a lot of hiking, mountain biking, and my body breaks down, and I've been in physical therapy. And we also have a really good technician who really is very cognizant of animal pain and her own
Mm,
struggles as a human. And she just
yeah.
thought there's got to be, and so really it was kind of her. I was hoping she would get certified, but it didn't work out. So I jumped in and the rest is history. But yeah,
But that's good though.
How does mobility directly impact longevity? And can you explain the connection between muscle preservation, joint health, and adding healthy years to a dog's life?
very good. Okay. So mobility, this might be a very interesting. I feel like, should I start with this study? This is an old study put on
Mhm.
by Purina. They took
Mhm.
Labradors and they separated the Labradors into a very controlled feed environment and a free feed environment. And so they're the same litters. They made everything as similar as they could. The
Mhm.
controlled feed, which controlled the weight, those dogs lived longer than their siblings who got free feed and got heavy or
Mhm.
obese.
Oh.
So in animals, we see a lot of these obese dogs. Again, I like sharing cases. I just saw the sweetest. It's a Chihuahua something mix who should probably be around 6 pounds, and he's 30 pounds. Okay, so we
Mhm.
talk walking ottoman. If you could radiographically see his knees, they are completely arthritic. And I
Oh.
think because of his obesity, because of his bad
Mhm.
knees, he literally popped his hip out of his joint. Okay.
What?
Hmm.
So as we talk about mobility directing impact longevity, this dog's only 6 years old. And if
Okay.
his hip doesn't stay in, most
Yeah.
likely he's going to be put to sleep. Okay, that's very sad.
Mhm.
And when it comes to animals too, if you look at them, what is their three things they work about? They want to eat, reproduce, and survive. So
Mhm.
we work on eating because we feed them. Reproduction's controlled because we fix them. But
Mhm.
surviving, they want quality. They don't want to be in pain. And a lot of these dogs that have joint problems, whether it be honestly athletic injury, doesn't have to be obesity, but obesity has a lot to do with it. And it's the saddest thing to see these 7, 8, 12-year-old golden retrievers, Labradors specifically, that are just mentally happy. They're ready to go. They want to play, but at their back end, they can't even move it. Their hips are
Mm.
so bad or their knees are so bad. And so physically, they can't do anything. They can't get around. Their quality of life goes down. They know, you can see it in their eyes. Dogs talk to us all the time,
Yeah.
and
Yes.
cats, other animals. I mean,
Yeah. Yeah. They talk to us. Like I look at yeah, for sure.
yeah, and you can see that they're unhappy, right? So that's how it impacts longevity. Sure, it revolves around quality of life. So the connection between muscle preservation and joint health, you can see like another case. This is a cool case. I have a client who has a cattle dog who is
Mm-hmm.
all muscle. This dog has got the thickest butt muscles and thigh muscles. I mean, he is just rock solid muscle. His hips are completely blown out. He has the worst hips I've ever seen. He's oblivious. He doesn't know. So that muscle is able to override the joint health in his particular case. Now, eventually he'll suffer from that. But for now, at 6, 7 years old, he's going strong. But
Wow.
so your muscle preservation, strengthening the muscles through rehab helps the joints. I think another thing to say here at this point, here's another interesting factoid, and I hope I get my facts right. It's been a while, but if a dog has 100% body weight, 60% is on the front end and 40% on the back end, and you divide that by 20 on one leg, 20 on the other, that's your 40, and then 30 and 30, there's your 60. Well, if I've got a bum leg, I'm shifting my weight, I'm transferring all that to those other 3 legs, right? And so that's going to cause problems in those joints. And then they
Mm-hmm.
break down. So then not only do I have a bad leg, now I have another bad leg.
Yeah.
We see that all the time as well. They've got a bad
Yeah.
left hip, so they favor their right leg, and then they blow their right knee, and then they've got 2 bad legs, right? So having muscle preservation, having joint health tie in very closely because they all work in unison. Adding healthy years to your dog's life. Yeah. So keeping them thin, keeping them, well, at least a good weight, but that's difficult too. That's a whole nother conversation about space and weight and all
Mm-hmm.
of that. But if they can maintain a good, healthy body weight, and just like with people, how many grandmas are knitting and they knit because their hands hurt? Once they get
Yeah.
moving, their hands don't hurt so bad. Same with dogs and arthritis. How many people say, when they get up, they're stiff, they move for about 3 or 4 steps and maybe 10 steps, and then they're much better, just like with humans and arthritis. So keeping your joints flowing, your fluids in your joints help a lot with that.
It's
Yeah.
so cohesive. Everything. I can't even ask for anything else. Like, I think this one's a different case. Your advanced dentistry, like specialty.
Yes.
We
Okay.
talk about this all the time, like how dental diseases shorten a pet's life. So maybe you can give us like your thoughts on that. Like, what's one dental symptom that signals serious underlying inflammation? Like, how do we know when it's already like progressing?
Oh, this is a great question. And sometimes we can't. I love dentistry. So where do I start with that one? Okay. One of the biggest periodontal concerns, if their teeth get too bad, is literally the bacteria in their mouths can get in their bloodstream
Mm,
and can cause heart problems. You can actually
yeah.
get bacteria to lodge on a heart valve. You
Mm,
can get kidney problems and liver problems. And so that's why it's important. Number 2, again, we go back to that. What's one of their 3 main things in animals? And that is to eat. They will eat through horrendous pain. They will
oh,
eat with broken teeth. They will eat with abscesses. They will eat with severe disease because they have to survive. They know they have to eat. And so they will eat through that. Now, we also have to remember, here's a little side note too, at least my opinion, the animal kingdom, they have a little bit higher pain threshold than human beings.
yeah. They're kind of stoic, right? Like the moment I see the pain, it's already progressing. They've been in pain. That's why I always like check on those guys. Like my guys, like I don't even wait. Like I'm the one
Yeah.
that's like,
Oh, yeah. I mean, we have dogs who come in with teeth that are wiggly and loose, and I make a joke, if you were to eat some taffy, that tooth would come right out. And they're just happy to go, they're still playing
it's just
fetch
gonna
and
get
tug of
sick in
war.
it.
Yeah.
Okay.
Now, here's the other tricky part. So, some fun stories. How do you tell if they're having disease? Well, sometimes it's too late. One of the fun stories, I was visiting a veterinary friend in Vegas, and we stayed at a friend of my wife's, and their dog, I watched him eat, and he would literally pick up some food, take it over, drop it, and eat one piece at a time. And I looked in his mouth, and he had literally a sewer in his mouth. The teeth were exposed, the roots were exposed. You could drive a van through what we call a furcation, which is
Mm-hmm.
the gap between the roots. They were all exposed on these major teeth. He just was in a lot of pain. So I encouraged them to take their dog in. And I think while I was visiting my friend, I actually went to his hospital and did a dental on their dog. My other favorite stories that really sticks out with me is a dog that we took probably, I don't know, 10 or 15 teeth. And when we rechecked on the dog, the owner came back and he said, Dr. Dooley, my dog plays fetch. He hasn't played fetch for 5 years. Like, we gave that dog
Mm,
his life, right?
wow.
Because he
Yeah.
wanted to play and all of that. My own personal dog right now, I have a little tiny 6-pound poodle we rescued, and it's very sad. He was not really abandoned. His owner died, and they were on a farm, And I think he was kind of left to his own vices for a day or two, but his mouth was full of what's called a foxtail, which are these nasty weeds that get in our socks.
Yeah.
I pulled out probably 30 or 50 foxtails out of his mouth, pulled all his teeth, and it was a rough recovery. It took him about 2 weeks to start eating hard food again, but he
Mm.
totally eats hard food. And his favorite thing, every morning and every evening, he is looking for his little hacky sack. I have a homemade hacky sack from a friend that was probably knitted. So it's not one of like the leathery ones. And he grabs it, he chases it, he throws it in the air. I mean, he totally uses his mouth because he's happy, right?
Yeah.
We don't want
Well,
to get to that level. So your question,
yeah.
like, how do you tell?
Mm.
Sometimes it's breed. That's another thing to go into, especially things like this. Smaller dogs are in our laps, and so we feed them junk food. We feed them from our table, sugary things. Big dogs like to chew more. You know, my son's got some golden retrievers. They're always chewing sticks. They're crunching. And he even said to me, because he was over on Sunday, and I was looking at his dog's teeth, and I said, "Oh, you might need to get your teeth in." And he 2 days, 3 days later, or a week later, he's like, "Hey, she's been chewing sticks. Half her tartar's gone." So, chewing on things helps a lot. But little dogs don't always do that.
No.
Brushing your teeth is very good. If you can get your dog to brush, that would be ideal. Now, again, people think brushing, we don't even brush our own teeth sometimes. Yeah, I do. Just kidding. Oh,
I
sorry. So it's good to rinse. It's better to chew, best to brush. And you don't have to brush their teeth like we do. They won't let you. You've got maybe
Mhm.
10 or 15 seconds. Okay.
Yeah.
But if you can make them sit down, brush their teeth, and then give them a reward, they're very happy.
Yeah.
Let's see. How does dental disease? Oh, so definitely shortens lifespan because either I'll recap that really quick. Heart disease, kidney disease, starving, they can't eat, they lose weight. We have a lot of
Mhm.
geriatric dogs that come in, they've lost weight because they're not eating very well.
Yeah.
It's also interesting. People go, they weren't eating, but I switched to soft food and now they're eating again. They can't do the kibble. It hurts their mouth, right?
Mhm.
Symptoms that signal serious underlying inflammation. Well, bad breath. Okay, now
Oh.
dogs have bad breath because they eat poo or
Mhm.
they lick their bum or their
Mhm.
breath just stinks because of cesspool. Like it is just bacteria. It is giant bacteria. So those are things to look for. Red
Yeah.
gums, just like human beings, severe gingivitis.
Mm.
Just, bright red gums, black teeth. Because if you look at a dog's teeth, again, they're kind of white, then they'll go yellow, then they go tan, then they go black and green,
Yeah,
and
yeah.
then you're in trouble.
Yeah. Well, because I see that too. Sometimes the new puppy we had, like we adopted him like 2 years ago, and I think he was still a puppy then, so his teeth was really clean compared to the older one.
Yes.
But I
Yes.
look at the teeth, like Tuxedo gets dental cleaning yearly because he had like issues with his tooth one time. He's got a very weird like gap tooth, and then he's eating CD diet, and then the food gets stuck in between, and I think it
Yeah.
got really bad. So we just have to pull the tooth out. Yeah, but I mean, the doctor thinks that Tuxedo's tooth is really clean, and I experienced like the change after the tooth was taken out. Thank you about the dentistry tips.
Right, before we go on, do you mind if I interject? We forget about cats too, right?
Oh yeah,
And
yeah.
horses. I mean,
Yeah.
cows don't nearly, but horses, they float horses' teeth because horses get these big barbs on their teeth in the back, and that will help
Yeah.
they have problems eating. Large animals need dentistry as well. Obviously, I don't do those because I'm a small animal guy.
Mm-hmm.
But, pocket pets like rabbits and other animals, they need their teeth trimmed
Oh
because
really?
like hamsters and rabbits, their teeth are constantly growing. Or ours, they fall out and they're gone. But rabbits, their teeth continually grow, so they have to be shaved down or chewed on. You have to have certain toys. And then
Oh.
cats get some serious disease too. Cats get resorptive
Mm,
lesions. They get stomatitis. And so every animal really does need some kind of dental
cleaning.
maintenance. We think mostly dogs, but like I
Yeah,
said,
but
we do treat cats and there are issues with them too.
Yeah. And cats like present very differently, because usually dogs, like they have the plaque and then the tartar and then they get
yeah.
gingivitis. But cats
What
can have like no plaque or no tartar and still have like a lot of gingivitis. So
also
cats
you just see like
are,
swollen gums?
yeah,
Yeah.
yeah. Bad breath, really red gums, yeah, pain. Like cats
Wow.
will like gnash their teeth. And I think cats, like I've seen those cats with resorptive lesions, those holes that are just like, it's like an open cavity right to their root, and they just chatter their teeth. They're so
Yeah.
painful if you touch them. And so I think I had a case when I was a new vet, and I had recommended a dental on this cat, and it was scheduled with another vet. And the other vet in the practice was like, I don't really think this cat's teeth are that bad, but I guess we'll go ahead and clean them. And I saw the cat like a few weeks later for a follow up, And the owner was like, he's a whole new cat. Like, I didn't realize how bad he felt. And she said, it really inspired me to go to the dentist and get a cleaning too.
Oh my
And I think, like, with dental disease in particular, it's kind of so slowly progressive that owners don't realize how bad their pets feel until their teeth, like, you pull out those broken teeth or the infected teeth. And after they recover, Dr. T, just like your dog, having like, he's just running around, he's playing, he's, because I think it just happens so slowly. Sometimes we don't realize how sick and how bad they feel until we get that disease out of their mouth. And we've, talked about this before on our podcast that dental disease doesn't get better unless you do a cleaning. Like, I think we have a lot of people that are worried for anesthesia, and that's understandable. We always try to take precautions and use the safest protocols and decrease anesthesia time. But if we don't take care of the dental disease, it's just getting worse and worse and worse. And it really does affect their entire health and their quality of life.
Yeah. I mean, that's
Yeah.
something too, because like a lot of people are pretty much against about bringing in their dog for dental cleaning, because like a lot of dogs apparently like don't wake up after. I've heard stories, I've seen stories online, so I'm like, I get traumatized sometimes reading it. But I think you just have to go to a trusted vet, I guess.
Yeah.
Ay, ay, ay. Okay.
I mean, the other thing too is,
Yeah.
is just is the power of the X-ray too. Dental X-rays find so much disease. If you look at
Oh,
dog teeth, 90% of their root or their tooth, 90% of the tooth is under the gum line. So
oh.
if your vet's not doing dental X-rays, you might want to find one who does.
Yeah.
And then, like Amber was saying, a lot of people will go, "Oh, he's just getting old." Not getting old. They're probably
Yeah.
in periodontal disease pain, and you
Mhm.
fix them, and they're vibrant. So
Yeah.
anyway, yeah,
I wish you have an office here in LA.
someday maybe.
Someday. Okay, Dr. Amber.
Antelope LA.
Antelope.
Yes.
Yeah. You can do number 5.
Another point on a dental is that, if we maintain it, then we can increase their longevity too and increase
Yeah.
their quality of life.
Yeah.
Instead of waiting until their mouths are so stinky and they're not eating and they have heart murmurs and they have high kidney values. Like, if we're maintaining, we're doing the at-home care if we can, like encouraging them to chew on dental treats, we're brushing their teeth, we're doing those yearly cleanings, then there's not as much risk over time for other health problems related to dental disease. So that's an important point that I like to make with my clients too. Like, the teeth don't look so bad now, but it's a great idea to do a dental cleaning,
Yeah.
Before they get so rotten that they're miserable and they're higher risk for anesthesia.
Yeah. Also now there's a lot of like tools, like other than just the typical toothbrush, right? Like I use the fiber. Like it's easy for me to go to the areas that I can, to clean it inside out.
Sure.
Yeah.
Yeah,
Yeah.
it's
Yeah.
better than
There's,
nothing.
Yeah.
yep.
So we try to
But
do it like every time before they go to bed.
good,
They don't like
good.
it.
Yeah, it takes about 36 hours for plaque and tartar to form on human teeth. And so we use the sort of the same thing with dogs. Just brush them once a day. I think to Amber's point too, if you talk about cost, if I have a dog who comes in and I have a basic cleaning and no extractions, much cheaper, much safer than doing extractions and all of that too. So sometimes getting them in sooner to do a preventative is better for not only your pocketbook, but the longevity of the dog as well.
Exactly.
Yeah.
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 Dr. T, if a dog comes to you with arthritis or post orthopedic surgery, what does the step-by-step recovery process involve, and how long before owners expect to see improvement?
Very good question. I think it really depends on the case. So let's look at a couple of them. Let's take a back dog, for example. Let's say a dog's blown its disc in its back. We call that intravertebral disc disease, or IVDD, and it's not walking. Those are the hardest ones to get to go because you have to help them walk. They're labor intensive, they're manually intensive, and they take probably at least at a minimum 6 months, but more like I've got one right now. We've been seeing her a year and a half, maybe 2 years, and she's just starting to walk on her own. Okay. So that's another thing with rehab is commitment.
Did she have back surgery, or she's
Yes.
just like, okay?
She had back surgery. And we've got another dog who he walks okay. He's had 2 back surgeries. and we've helped rehab both of them, but he's still a little off. They're never quite normal.
Mm-hmm.
Now, let's look at another case like, okay, TPLO, for example. A lot of dogs will walk without having, but some just struggle. I liken it to this, and I'll use what's called an FHO, which is where we actually cut the head of the femur off of a dog's leg. It's what we call a salvage procedure. They lose confidence in their leg. They lose trust. The leg hurts. Then I had surgery. I don't dare put it down. My muscles atrophy. They become weak. My leg is weak. I just don't trust it. And so that's one of the things I talk to clients about is, okay, we got to get them to trust their leg again. We have to force them to use it to go, hey, look, it's fixed. You can use it. It's not as painful. And once they start getting that figured out, we just had a little tiny dog come to us from another veterinarian who did an FHO, little tiny 9-month-old Chihuahua again. And he was not using his leg at all. He wouldn't put it down. He was hopping. They can hop 3-legged so easy. They can just get around. So it took a lot of effort. I think we've been 4 months with this dog, and I think she's done coming to us. He's now using it 90%. She's very happy. His muscles are coming back. He's running. He's playing. He still has a little bit of a weird gait, but you think about it, we took his hip joint out, right? So it's all the muscles. Going back to that question about muscle preservation, yeah, it's totally the muscles kicking in. You fix that problem. Let's look at a agility dog. We had an agility dog come. He's been coming for about 4 months from a soft tissue injury, and he's probably not quite ready to go back to agility, but we've got him so he's pain-free and using both his legs again and can actually start to lightly exercise to get back into hopefully competing. Basic TPLO that's healthy, that comes right back, go and have surgery, and you instantly go into rehab. Your recovery is probably twice as fast if you don't have rehab.
Wow.
We've got a couple of dogs. Here's another real amazing case. So this dog, it's amazing. It was a nerve-wracking case. She has bilateral hip dysplasia and bilateral blown knees.
Wow.
She could not get around. Owner was really she had quality of life. He just really wanted to see what he could do for her. So I did a bilateral TPLO on both knees. That's what bilateral means, obviously. And she almost went home walking because the pain that she had was more than the pain we did with surgery.
Wow. Yeah, they're very
Amazing dog. And then she got in the rehab pool, and he is just elated. He is such a happy owner because she can get around, less pain. You talk about that longevity of life. She's happy. Their bond is developed. And so it's just amazing what they can do, let alone on their own. But just that little bit of extra help from us really helps them go longer. So time-wise, it is honestly case-by-case basis. I've had other TPLO dogs that have been referred to me that I didn't do the surgery. And again, they just don't trust their leg. They're not sure. They're not confident. I'll get a couple of referrals for dogs who tear their Achilles tendon. That's a very recovery. They have to be in a boot. They have to be in a boot in the pool. Those are 6 to 8 month recoveries before you trust that because of soft tissue. So I think that question is really a great one. But I think people who are listening to this that are thinking of doing rehab have to be prepared, be committed. You have to be prepared to do things at home, because the more you do at home, the better our job is. Because I have a few clients like now, again, I have a back dog. Owner doesn't do a thing at home. He comes twice a week. We do everything, and the dog's not progressing. She's just not going to get better. And I'm throwing it back on the owner. It could be the case too, right? Some dogs just aren't going to walk after surgery. It's just a sad fact, but you don't know if you don't try.
Yeah.
So really just knowing that it's going to be case by case basis, but on average, 4 to 6 months for your standard orthopedic procedure. There you go.
Yeah. Well,
how about for weight loss? I remember that little dachshund that would come in for underwater treadmill. So what is your course for a weight loss case?
That is a very good question. And I think in embarrassment, I don't know that it works. I have not found a successful true weight loss unless the owners are really on board themselves, because what they will say to me though is their stamina improves. They can go further, they can walk, they can get around better, they can breathe better, but I don't know that I can convince them to not give them the treats or overfeed them. We did have, I can't say name. Anyways, this dog, the owner actually did help him lose weight. He dropped weight. Sad thing is, as soon as she stopped physical therapy or weight loss, he gained it all back. right?
Mm.
So sometimes I think people aren't exercising their pets and they use us for exercise. So weight loss is still a little bit tricky. I just don't know if I figured out how to really do it yet to be successful and
Yeah.
feel. So we don't advocate it and we don't push it much anymore.
Yeah.
Well, I feel like it's also tricky when an animal is on steroids. Like I have a guy here that's taking a steroid. I feel bad when he's pushing me to open the doors or to give him food. Just
Yeah.
drink water. But I really push him to have his regular exercise too. So yeah, I'm in the same boat. Oh my God, you lost weight like 2 weeks ago and now you gained weight again because we left you and you got a lot of treats and now I'm having a hard time like.
Yes.
So, Dr. T, since you've been in the community for over 2 decades and have seen pets grow from puppies to seniors, I think you mentioned this already. Yeah. I mean, I think you mentioned a few examples of your client that was able to move again and thrive. What does that transformation mean to you personally as a vet and a practice owner?
That's a great question. And I would liken it to anything that's just amazing. People who get hole in ones, people
Mm-hmm.
who pass a test that's really hard, maybe having a child. And maybe that's a little bit too, I mean, having a baby is amazing. Isn't birth just the most amazing thing?
Yeah.
The human body is just amazing. So when you see an animal who goes from inability to get around or truly suffering quality of life, like, I mean, it's life or death almost. It's like, we're going to put this dog to sleep if we can't get him better.
Mm-hmm.
Um, and all of a sudden they're thriving and they're able to run and play and go back hiking and bring the joy,
In their
not only to
face?
themselves, but probably maybe more the human animal bond, right?
Yeah.
If you look at that human animal bond, why do most people have pets? How
Mm-hmm.
many people use pets not only for companionship, but again, another little sad moment here was I put a dog to sleep Tuesday night. And as the owner is crying and feeling those emotions, these are the words she says: "You helped me get through so many hard times." So I think from our perspective as veterinarians, when we can return that human animal bond as close to 100% as possible, it is payback hundredfold.
Mm.
It
Oh,
is
that's
fully
amazing.
worth it. And it keeps you driven and keeps you focused on how do I truly stay on top of my profession,
Yeah.
be on top of learning. You mentioned in the beginning, okay, so yeah, I started at a vet hospital, but we're always trying to grow. I'm doing rehab, and I'm like, why don't I bring orthopedics here? Let's
Mhm.
keep it under one roof so that we can be kind of more like number one. I know that, and now that I know the surgeries, I understand what animals are coming to me. So I'm a better physical therapist or rehabilitation practitioner, for the purists. Because I understand what the animals have gone through because I've done it to them
Mhm.
in a good way.
I bet there's too many to mention for sure, but
Yeah,
I
but
just love that I can feel, you know what? I feel the love, the warmth, and I feel like the energy behind your purpose. And it's just amazing. Like, I mean, I know all vets really are drawn to that because I mean, I'm scared of blood. I'm scared of anything, but I love animals. So that's why I'm keeping this side of the business. And at the same time, my purpose on like reaching out, trying to create like supplements or at the same time like empowering pet parents to know more. But yeah, I just really felt it. It was just
good.
amazing.
Yeah,
Thank you. Yeah. I mean, that's why I always feel like, how hard it is for vets because like some pet owners, like the level like of stress bringing in the animal and sometimes like some people don't even like I remember when this was overseas, like when I had my first puppy, like my vet was saying like, you know what, some people don't even pay right because, they complain when they see the
yeah,
bill. Like I will never forget that. And I'm like,
yes,
why? They should pay vets more.
yep. And I can answer that. I think it comes down to perceived value. They don't perceive the value that we're offering. They don't see it. We maybe don't communicate it very well. It's sometimes hard to see the value that we have tried to provide or we failed. If
Yeah,
we're honest with ourselves, we failed to giving them the value that they were looking for, and that
yeah,
makes them upset, you know?
yeah.
And maybe another one, I don't know, Amber, how do you feel about this one? But emotions too. It goes back to that. This is my child. This is my baby.
Yeah.
This is
Yeah.
that and the emotions that come. And sometimes I think people, I don't know if they speak before they think, like, because
Yeah.
a lot of them will come back and go, "Oh, I'm sorry, I didn't mean to do that." Emotion
Yeah.
speaks sometimes before their mind speaks. So I
Yeah.
take
Yeah.
that tongue in cheek, but it does hurt. Oh, it stings. Man, you have gone up and in our minds, we've gone above and beyond. We've
Mhm.
even maybe discounted things because we know it's tight, and then they still complain, and you kind of get jaded. You kind of get mad and bitter, and then you're not so nice maybe to the next client because you're like, well, or the next time they come in, you stick it to them. Okay, you might
I
stretch it.
know.
Anyway,
Yeah. That's why I'm like,
Yeah.
I'm very mindful when I have to go because especially me, like I'm like, I don't want to leave my dog and just for pickup. Like I always want to be there. Like I always wanted to have an in-room appointments, but yeah, hopefully my vet doesn't get crazy with me because I ask a lot of questions, but being able to work together and how I can keep them healthy. Yeah.
Okay. If every pet parent listening today could change just one habit to add healthy years to their pet's life, what would it be? What would you recommend?
go for actual walks. So many clients say, well, they play fetch in the backyard.
Mhm.
When we go for a long walk, 2 or 3 miles, that gets your heart rate up and helps burn calories. Playing fetch in the
Hmm.
backyard for 5 or 10 minutes, it's not a calorie burner. So
Mhm.
I have a hard
Hmm.
time when clients say, well, they get exercise, they play fetch in the backyard, I throw the ball. So go get out and go for a walk. Not only will it help your pet, but it will help you with your own endorphins and the beauty of the world around you. You get to see it.
Yeah. Mm,
Yeah,
That's
that's
so
great advice.
yeah. And then, you give them like their news of the day. When I'm out and on a walk like 2 blocks with the guys, it will take me like maybe 45 minutes if it's just 2 blocks because like the guys wanted to sniff.
Yeah.
And I always give like new areas like every day they have like, oh, we'll go to the other side again today. Like I always change the walk because I want them to be curious all the time.
Yeah. Yes. They need stimulation too.
Yeah, stimulate. Yeah.
Just like, yeah, okay. Rehab is only for post surgery patients, myth or fact?
Myth.
And one thing every dog over 5 should start doing today.
Brush your teeth.
Nice.
Yeah. Takeaways, Dr. Amber?
Well, I think, I mean, I've known Dr. T for many years, and I think he's amazing as a person and as a vet.
Yeah.
And I do truly see that calling he's talking about in him every day. He shows up ready to help people and help their pets and learn more. And that's why, like he did orthopedic surgery, he does rehab to just really just help more people and more animals.
Yeah.
So thanks, Dr. T.
Yeah, my
Right.
takeaway is really like how like the one thing that Dr. T mentioned about the bond after every like maybe post surgery because that's really where the animal also trusts you and sees you because like I experienced that with my tuxedo and I feel like our bond got stronger and deeper after having his bladder surgery after I took care of him to make him feel better like yeah, that's my takeaway. And I love that you pointed that out in this conversation.
Great. Thank you. I just thought of a really good story about a
What is
case.
it?
Okay, so this really pushed me to the limits, not only faith, but in my skills as a surgeon. I have a very
Mm-hmm.
good family friend whose son serves a mission for his church, and this dog he has is kind of his therapy dog. Well, the
Mm-hmm.
family's on a trip to California. Babysitters let dog out. Dog gets hit by a car. Okay, so they find the dog. The dog has a dislocated hip and a broken femur. And she called me and said, Paul, you're the only one that comes to my mind. And I'm kind of like, I'm not comfortable with that. That's beyond my skill level. And she just talked me into it. And so I studied and I thought, well, if I can do a TPLO, I can maybe do this. So I had a plate and I did a pin. So I pinned and plated his broken femur and I sort of did some research on pinning a hip. And so I drilled a hole through the hip and and it's called a pen and toggle. And that was probably in October timeframe, spring, early fall, excuse me. Well, this Christmas time, December, they came in and the dog is walking on all 4 legs. He
Oh,
hikes with the mom who she loves to take him hiking. And he was wagging his tail and he was happy. And so that to me, again, is another one of those stories where, okay, you challenge yourself, you have some basic skills, you put faith in yourself, your staff, your skills, and do what you can. And the body's amazing. and took care of the rest of it. And so that's maybe my takeaway is don't forget how amazing the body is. If given a chance, it can repair to the best of its ability and quality of life can be refound, which then takes us back to the bond. So there's my takeaway.
Oh, that's so amazing. I like that. Yeah. Thank you, Dr. T.
You're welcome.
That's really, yeah, I love that. Dr. Amber, like I'm blown away.
Yeah.
Like I'm just like, because I'm a believer in like our body's very intelligent. I mean, Dr. Amber saw me last week, and I was like, same thing too with my animals. Like I talked to them like Tuxedo is now 13. I have his he has some fatty lumps in my head. I'm like, oh, I just wanted it out, you know. And then Kyle's like, maybe we could take it out, but my vet always says no. It don't let him go through another surgery because he's been to he had two bladder surgery over the past 3 years, and we just want him to relax a bit. And he just got diagnosed with Addison's, and we'll just make everything like normalize and balance before we even want to do that. And it's not hurting him. But again, I'm like, okay, so every day I talk to his bump. I'm like, okay, I know you're telling me to be, not to control. Like, thank you for reminding me that I can still love him even if he doesn't look the same, because he's very happy. So I'm with you on that, and I really like that you mentioned that, how because our body really is very intelligent. I believe that.
Yeah, absolutely amazing.
Dr. T, thank you. Sorry, I just can't say Tonioli. You've just been Dr. T to me so long. Okay.
Yeah, you just say Dr. T.
Yeah, that's okay. I like Dr. T.
Dr. T, thank you so much for sharing your expertise and your passion for rehab, longevity, and advanced veterinary care. Your insights show just how much early intervention can truly transform a pet's life.
Yeah, absolutely. Yeah.
Thank you, Dr. T. And how can our listeners reach you?
How can our listeners reach me? Well, they can email me, Paul at antelopevet.net. They can call our hospital. Antelope Animal Hospital is at 1-779-7970. You're more than welcome to come visit from LA. We'll accept new clients all the time. If people want to call and ask questions, we can help out with whatever they need. But those are the ways they can reach out to me.
Yeah, amazing. And to our listeners, remember, mobility is longevity, dental care is whole body care, and proactive rehab isn't just recovery, it's prevention. So if you enjoyed today's episode, share it with a fellow pet parent who wants their pets to thrive for years to come. Follow us on your favorite podcast platform to never miss an episode, and join us next time for more actionable tips to help your pets live their best life.
You can email us at podcast@vitalpetlife.com or tag @vitalpetlife on social media. We'd love to share your insights with our listeners and viewers in a future episode. Stay curious, stay proactive, and keep your pets thriving.